We are all forming cancers in our body all the time. You have cancer, I have cancer, and we have been producing these microscopic cancers since we were children. Let me explain what I mean by that. Because once you understand this, everything about how you think about cancer is going to shift fundamentally. And I also want to address a question that genuinely keeps researchers like me awake at night. Why are we seeing both common and uncommon cancers being diagnosed at younger and younger ages? What is happening to our defenses? And more importantly, what can you actually do about it starting today? I'm Dr. Berg. I have spent my career in cancer research and immuno-oncology, an approach to treating cancer that does not rely on chemotherapy or even targeted therapy, but instead works by activating your own body's immune system to identify and eliminate cancer itself. And the discoveries coming out of this field right now are genuinely jaw-dropping. Let's start with the foundation. Cancer is the disease that most of us fear more than almost anything else. Doctors fear it too. We get cancer just like everyone else, and we have watched its devastation up close in ways that most people, fortunately, never have to witness. I have had cancer in my own family. Most people do not have to look very far to find someone whose life has been touched by this illness, but I want to offer you a perspective that most people have never heard, one that actually reframes the entire conversation. Your body is made of approximately 40 trillion cells. Every single one of those cells has to divide and copy itself continuously. Copy, paste, copy, paste. That process of cellular copying is what keeps you alive from one day to the next. And copying 40 trillion cells means copying the DNA inside each one of them. The complete genetic instructions set for your entire body. That is an enormous job. And mistakes happen. Each mistake is called a mutation, and cancers grow from mutations. So when I say we are all forming cancers all the time, here's what I mean. Think about typing out a simple sentence. Say, Mary had a little lamb, 10 times on a keyboard. You will get it perfectly every time. Type it 100 times, and you will make some errors. Fortunately, word processors have spell check. Your body has the equivalent DNA repair mechanisms that catch and correct mutations before they become a problem. But ask someone to type that same sentence 40 trillion times, and I guarantee you, no spell checker on earth can keep up with every error. Each uncorrected mutation becomes a microscopic cancer. Tiny, harmless, invisible, like a small blemish on your back that you cannot see and that will never cause you any trouble. Most of them will simply disappear on their own. And for the ones that do not disappear on their own, your immune system handles it. Think of your immune system as police officers on a regular patrol through a quiet neighborhood. They spot something that should not be there, a microscopic cancer cell, and they remove it immediately before it ever becomes a problem. That is how our bodies normally deal with cancer, continuously, silently, without us ever knowing it is happening. So the question that researchers are urgently asking right now is this: why are our defenses apparently going down while cancer diagnoses, and particularly in younger people, are going up? Is it that our immune systems are weakening? Is it that our gut microbiomes are changing, and with them, our body's capacity to manage inflammation? Because those tiny microscopic cancers that would normally never become a clinical problem seem to be advancing into actual disease at younger ages than we have seen before. We do not have a complete answer yet, but it is exactly the right question to be asking. And there is another dimension to consider. Are we being exposed to increasing amounts of harmful substances in our environment? Microplastics have become one of the most significant emerging areas of concern in health research. We are finding them in the blood, in the brain, in essentially every organ system we have examined. Where do the majority of inhaled microplastics come from? Vehicle tires on roads shed aerosolized microplastic particles continuously. We breathe them in. They enter the body. And while the full extent of the damage they cause is still being studied, the early evidence is genuinely concerning. Practical steps you can take right now. Avoid microwaving food in plastic containers. Minimize food stored in plastic packaging when alternatives exist. These are small adjustments that reduce your daily microplastic exposure meaningfully. Here is something that represents a genuine shift in how we approach cancer. A shift that was not possible until relatively recently. If you find a cancer early, your chances of eliminating it completely are dramatically better. We have always known this in principle. but we are now developing the tools to act on it in ways that were previously not available to us. Early interception of cancers is now something we can actively pursue, and late interception, in cases of very advanced cancer, is now producing long-term remissions that I am comfortable calling cures. I have personally witnessed patients with stage 3 and stage 4 cancer, cases where conventional medicine had essentially reached its limit, achieve complete elimination of their disease through immunotherapy, and maintain that result for a decade or more. Something I genuinely believed I would never see in my career. I want to be honest with you. We cannot deliver that outcome for every patient yet. We do not fully understand why some patients respond completely while others do not. That is the frontier of the research. But the fact that it is happening at all, that it is possible, represents one of the most significant developments in the history of oncology. Let me describe something that is currently available in clinical trials, because it represents where the future of cancer treatment is genuinely headed. Imagine a cancer is removed from a patient and sent to a laboratory along with a sample of that same person's healthy blood cells. The laboratory sequences the complete genome of the cancer, 20 to 30,000 genes, and simultaneously sequences the genome of the normal cells from the same individual. Then machine learning and artificial intelligence are used to compare these two genetic profiles exhaustively, identifying every mutation present in the cancer cells and subtracting out any mutations that also appear in the normal cells. What remains is a precise map of only the mutations that belong exclusively to the cancer. No more secrets. The cancer's complete genetic blueprint is exposed entirely. From that map, researchers select 20 to 25 specific mutations and essentially string them together. Think of each mutation as a pearl, and the combination as a pearl necklace. That combination is then used to print the corresponding protein sequence. That protein is injected under the patient's skin. You have just vaccinated yourself against your own specific cancer. Nothing is more personalized than that. Nothing is more targeted. And the results in the cases where this has been applied are the kinds of outcomes that make an experienced researcher stop and question what they thought they understood about the limits of medicine. A patient with stage 4 brain cancer who currently has no detectable disease. That is not a statistic. That is a person who is alive. Here is something that directly connects to what you eat and what you can do at home. And it is not a minor footnote. For people currently undergoing immunotherapy, this may be one of the most important pieces of information available to them. Research conducted in Paris has demonstrated that patients receiving checkpoint inhibitor immunotherapy who have a specific bacterium called Akkermansia in their gut are significantly more likely to respond positively to the treatment, meaning their own immune system successfully eliminates the cancer. Patients who lack this bacterium are substantially less likely to respond. In that context, the presence or absence of a gut bacterium is not a minor wellness consideration. It becomes a factor with life or death implications. How do you support Akkermansia growth? Specific polyphenol compounds called L-argitannins, found in pomegranate, dried cranberries, and certain grape varieties, promote the gut environment in which Akkermansia thrives. Akkermansia supplements are also available, but as I consistently tell my patients, food creates an environment that supplements alone cannot fully replicate. Use both if you can. The intersection of diet, the gut microbiome, and cancer treatment outcomes is one of the most rapidly developing areas in oncology right now. And it is one where patients can take meaningful action independently, not waiting for the next appointment, not dependent on the next infusion. When you go home today, what you choose to eat is part of your cancer treatment strategy. Let me address diet more broadly, because this is an area where strong opinions often crowd out nuanced thinking, and I prefer nuance. Does eating a plant-rich diet support health? Yes, consistently, across essentially every major research study. Plants are good for you. That is not a contested point in the evidence base. Does that mean meat is categorically harmful? I do not think in those binary terms, and I do not think the evidence supports that conclusion. Meat provides high-quality protein and micronutrients. creatine, carnosine, among others, that are not easily obtained from plant sources alone. The research suggests that moderate meat consumption is compatible with good health for most people. What about saturated fat? The evidence suggests reducing it is a reasonable choice, not eliminating it completely, but moderating it. You do not need to remove every food you enjoy from your life. That approach is neither sustainable nor, in my view, necessary. When I sit with patients who are anxious about what I'm going to tell them to eat, I always start with the same question. What do you love? What smells from a childhood kitchen make you feel at home? What foods genuinely bring you pleasure? I start there, because sustainable dietary change has to connect with who you actually are, not with an idealized version of a diet that has nothing to do with your real life, your culture, your history, and your relationship with food. Anything consumed in extreme excess is likely not serving you well. Beyond that, the evidence for rigid dietary absolutism is weaker than its most vocal advocates would have you believe. I want to briefly address the role of biometric monitoring in health, because the biohacking movement raises genuinely important questions about how we use health data. The history of what we now call biohacking actually traces back to the NASA astronaut programs of the 1960s, where scientists were working seriously on how to monitor the physiological status of humans launching into space in real time. This is not a concept invented by social media influencers. It has a serious scientific legacy. There is genuine value in understanding your own health metrics. VO2 max, high sensitivity CRP, fasting insulin, and similar measurements can provide meaningful insight into how your body is functioning. But there is a risk that comes with obsessing over numbers. If every reading that falls outside of a theoretical optimum becomes a source of anxiety, the monitoring is working against your health rather than for it. The Western tendency toward reductionism, the belief that if we can just identify and optimize every individual metric, we will achieve perfect health, can actually undermine the broader quality of life that health is supposed to support. The martial artist Bruce Lee, who continues to be quoted and studied decades after his death, said that the ultimate knowledge is self-knowledge. I think about that in the context of health frequently. Knowing what makes you feel well, knowing what gives you energy and clarity and contentment, knowing what your body responds to positively. That kind of knowledge, personal, experiential, accumulated over time, is not captured in any blood panel, and it is not less valuable for that. Use the data, but do not let the data use you. Let me leave you with this. We almost treat aging as synonymous with inevitable decline. We assume that as the body ages, disease accumulates, and there is little to be done about the trajectory. I do not believe the research supports that assumption, and the field I work in is one of the strongest arguments against it. I have watched people arrive in my clinic with diagnoses that would have represented a terminal prognosis a generation ago, and I have watched some of those same people leave that disease behind entirely, their immune systems properly activated and supported, doing what they were always designed to do. The end of cancer, true, durable elimination of this disease, is not a fantasy. The science that will get us there is being developed right now. Some of it is already here. If you or someone you love is dealing with a cancer diagnosis and immunotherapy has not been part of the conversation, raise it. Ask your oncologist directly whether immunotherapy options exist for your specific cancer. Search your cancer type alongside the words immunotherapy and clinical trial. Advocate for yourself. The information is accessible and the treatments are advancing faster than most people realize. And in the meantime, eat the foods that support your immune system. Build a gut microbiome that gives your defenses every possible advantage. Move your body. Reduce your toxic exposures where you can. Sleep. Your body has been building and defending against cancer your entire life. Give it what it needs to keep winning. I'm Dr. Berg. Thank you for being here.